Good morning, everyone. Lots going on as usual, and I'll remind you to join the mailing list just in case YouTube cuts me off for whatever reason. And I also send out a weekly newsletter. The newsletter is I've already sent out 4 of them, and I'm still working on the formatting of it. I'm still working on the structure of it, but I think I'm getting closer. So join in on CanadaPoly.com or CanadaReport.co. You can join here. Some people have emailed me as well, and I think I've added most of those people to the mailing list, so that's good. You can also join the forum at CanadaPoly.com. When you land on the homepage, it looks different, but click the forums in the menu and it'll take you here, and you can join in the conversation. We're talking about a lot of stuff, and let's get into the news. Okay, I saw this yesterday, and it made me laugh, and I said, if this is real, I would go to this. I went to Edgefest 98 in Barrie, Molson Park in Barrie, and with Green Day and Moist, and I think Treble Charger was there, and Sloan was there. No, maybe not Treble Charger. Sloan was there. There was a bunch of people. I was looking at the Foo Fighters were there. Foo Fighters headline. It was a good show. It was a fun show. So yeah, I would go to this because I am from the era that most of these guests are from. This is fake, but I'll read it to you because I thought it was pretty funny. The Snow Treble Charger doubleheader, right? With Paul Schaefer, B44, the Moffats, the Trues doing the greatest hits of the Sheepdogs, the cast of Ready or Not, Malcolm Gladwell. I was like, ooh, Malcolm Gladwell will be there. The Arkells and Our Lady Peace. Our Lady Peace was there as well. They workshopped Thief at that show. Anyway, so I would go to this. Somebody was saying, the comments in this whole thread are hilarious and worth a walk through because it's funny. And you need to laugh these days. Need to laugh. Okay, here is Home Hardware in, I don't know where this is actually, in my hometown. So wherever, if you know Richard Colbeck from his hometown, and the Home Hardware there says Fire Forward Open Ontario. A bunch of different people sent me pictures of this yesterday, right? So this is great. Everybody's taking pictures of this. Like, Home Hardware's done. Home Hardware's done, Doug. Do you hear them? Do you see the sign? This is how Canadians rebel. Hashtag Fire Forward. And who's going to lead us out of this? Is there a politician out there brave enough to say we're opening like Florida and Trudeau can sue me? Like, who's going to do that? Who's going to do that? I don't know. Here is Aaron O'Toole trolling the haters. And Aaron O'Toole says, hey, I brought Rebecca a glass of rosé after my run today. Hope everyone is enjoying a relaxing long weekend. Okay. I think O'Toole is an ineffective CPC leader. However, funny. Good one. He got that one. I'll give it to him. That's pretty funny. BC politicians want to change the province's name and flag to reflect diverse society. This did not pass, thankfully, but makes for fun memes. There was some people did the No Name President's Choice brand for BC instead. Non-denomination Columbia, non-binary, non-denominational Columbia instead of British Columbia. Heard that one? I thought that was pretty funny. I don't know, man. I don't know. All of this stuff is divisive. We're going to talk about Quebec and their constitutional challenge and the fact that everybody's pretty cool with it. NDP, yeah, okay. Even the Conservatives, even Aaron O'Toole, he's like, oh yeah, Quebec can do that. Sure they can. No problem. BC changed their name. The province was named in 1858 by Queen Victoria as British Columbia. Somebody had already named the part of British Columbia Columbia because of the river, and then so the Queen. There you go. In 1858. So before the name predates Canada, and they want to cancel it, right? Crazy. Remember the other, I don't know, probably months ago now. This is a robot dog, okay? And did you watch Stranger Things? Okay. Picture Stranger Things. And did you watch a few months ago there was an Imperial March with a bunch of these robots looking things, and the Imperial March went and the robots were marching, and it was for a robotics company that was making robots that looked a lot like this or similar to this. And it was kind of terrifying, right? Because I remember watching Terminator and, Skynet and all of that stuff, and it looks eerily similar. This is worse. This is Singapore, and this is a physical distancing checking robot. That's what this is. Here we go. This robot is patrolling a park to reinforce social distancing messages.
Let's keep Singapore healthy. For your own safety and for those around you, please stand at least 1 meter apart. Thank you.
The authorities say the tech will not track individuals. Thank goodness. But the cameras will monitor how busy the park gets.
Stand at least 1 meter apart.
And then the dog will approach you and say, please stand 1 meter apart. Thank you. So an English-speaking dog that will chase you away from other humans. Humans are literally being like monitored by robotic sheepdogs that we've built. Is this something that we want to be doing? Is this like, oh yes, no, I agree. My health is your health. Please herd me, robotic sheepdog. Like, it's wild. This is incredible, right? Oh, it's so non-invasive. You could pet the dog. I wonder if you could ride the dog. They'd probably get angry if you tried to ride the dog. I feel like kids would do that. I would. See, I'd think about it and I'd suggest it. I don't know that I'd do it, but I might do it. I don't know. Justin Trudeau, okay. In 2019 or 2020, I can't remember exactly when this happened, Justin Trudeau labeled the Proud Boys terrorist organization, and there was a big conversation about this, and I've been talking about how you can say that the Proud Boys are a terrorist organization, or even extrapolating out to white supremacy as a terrorist organization, when you can't name a white supremacy organization operating in Canada. And the Proud Boys made a statement, I guess, that said, like, we don't even have any chapters in Canada. Like, what are you talking about? And I could name 1 or 2 white supremacy organizations, so-called, and only because they were in newspaper articles a few years ago. I think Sons of Odin is the one that comes up. KKK, right? Like, those are the ones that come up in the top of my head. But try joining one. Like, where do you go? Is there a website? Like, is there a Facebook group that you could anybody point me to? I'm interested because they're the biggest threat and they don't seem to be really active, right? And when you compare it to people like the Extinction Rebellion shutting down bridges, when you compare it to unions shutting down refineries, when you compare it to other people lighting things on fire and throwing at railroad tracks, these aren't white supremacy people doing this. These aren't people saying anything about race, I don't think, as far as I'm aware, and they're lighting tracks on fire for equity or something like that. I'm not sure if it's racial equity. Anyway, there's lots of different grievances being protested. But again, how can you make a statement like these are the most dangerous terrorist groups when you ignore Antifa, right? Or other terrorist organizations, again, lighting railroads on fire, blockading roadways, et cetera, and you ignore this. The Iranian, yesterday I reported on an Ontario Supreme Court judge saying that the shooting down of the plane by Iran was an act of terror in early 2020, and so that paves the way for the families to sue Iran to get financial compensation. But it says in June of 2018, says Tom Quiggin, Justin Trudeau said he would list the Iranian Revolutionary Guard as a terrorist entity. In January of 2020, the IRGC killed 75 Canadians by shooting down the plane. We just talked about that. In May 2021, a Canadian Superior Court judge said this was a terrorist act. Justin Trudeau still has not listed them as a terrorist organization. Is this incompetence, or is this part of a plan? Right? Who knows? I don't know. I really don't. Is it just incompetence? Here's an interesting article. It says, few answers after 3 die suddenly in downtown Edmonton Park. No names, no ages, no anything. 3 people are just found dead in an Edmonton Park. And the news article speculates about drug overdose and how terrible the drug scourge has been, the opium crisis and all this other stuff. But it doesn't give any information about who these people were and ages of the people. And I know I said that, but like, it seems like if you're going to speculate a bit about drug overdoses, et cetera, and not to shame anybody, but like, you need to give a bit more information than what's given in the article. And the article goes down a garden path of speculation, but it doesn't actually give a lot of solid information. It would be better if the article said, like, here's the information and we're being stonewalled, right? Because then people at least would understand what's going on. This one tries to offer an explanation, but it's speculative, and that's not really helpful because it's speculative. I'll tell you a story from 2007, and it does apply to today. Now, New York Times, this is paywalled, okay? But I'm showing you that this is from the New York Times in 2007, and then we'll go to, well, I mean, I guess the archive link works too, but you can get both. So this is the archive link of this article. Faith in quick test leads to epidemic that wasn't, okay? January 22nd, 2007. Dr. Brooke Herndon, sorry, an internist at Dartmouth Hitchcock Medical Center, could not stop coughing. For 2 weeks, starting in mid-April last year, she coughed seemingly nonstop, followed by another week when she coughed sporadically. Annoying, she said, everyone who worked with her. Before long, Dr. Catherine Kirkland, an infectious disease specialist at Dartmouth, had a chilling thought. Could she be seeing the start of a whooping cough epidemic? By late April, other healthcare workers at the hospital were coughing, and severe, intractable coughing is a whooping cough hallmark. And if it was whooping cough, the epidemic had to be contained immediately because the disease could be deadly to babies in the hospital and could lead to pneumonia in the frail and vulnerable adult populations there. It was the start of a bizarre episode at the medical center, the story of the epidemic that wasn't. For months, nearly everyone involved thought the medical center had had a huge whooping cough outbreak with extensive ramifications. Nearly 1,000 healthcare workers in the hospital in Lebanon, New Hampshire, I think NH, were given a preliminary test and furloughed from work until their test results were in. 142 people, including Dr. Herndon, were told they appeared to have the disease, and thousands were given antibiotics and a vaccine for protection. Hospital beds were taken out of commission, including some in intensive care. Then, about 8 months later, the healthcare workers were dumbfounded to receive an email message from the hospital administration informing them that the whole thing was a false alarm. Not a single case of whooping cough was confirmed with the definitive test. Growing the bacterium Bordella pertussis, sorry if I got that wrong, in the laboratory. Instead, it appears that the healthcare workers probably were afflicted with ordinary respiratory diseases like the common cold. Now, as they look back on the episode, the epidemiologists and infectious disease specialists say the problem was that they placed too much faith in a quick and highly sensitive molecular test that led them astray. There are no national data on pseudo-epidemics caused by over-reliance on such molecular tests, said Dr. Trish Pearl, an epidemiologist at Johns Hopkins and past president of the Society of Healthcare Epidemiologists of America. But, she said, pseudo-epidemics happen all the time. The Dartmouth case may have been one of the largest. Hold my beer. But it was by no means an exception, she said. There were similar whooping cough scare at a children's hospital in Boston last fall involving 36 adults and 2 children. Definitive test, though, did not find pertussis. It's a problem. We know it's a problem, Dr. Pearl said. My guess is that what happened at Dartmouth is going to become more common. Many of the new molecular tests are quick but technically demanding, and each laboratory may do them in its own way. These tests, called homebrews, are not commercially available, and there are no good estimates of their error rates, but their very sensitivity makes false positives likely. And when hundreds or thousands of people are tested, as occurred at Dartmouth, false positives can make it seem like there's an epidemic. Quote, you're in a little bit of no man's land with the new molecular test, said Dr. Mark Perkins, an infectious disease specialist and chief scientific officer at the Foundation for Innovative New Diagnostics, a nonprofit foundation supported by the Bill and Melinda Gates Foundation. All bets are off on exact performance. Interestinger and interestinger. At Dartmouth, the decision was set to use a test, PCR, for polymerase chain reaction. It's a molecular test that until recently was confined to molecular biology laboratories. That's kind of what's happening, said Dr. Catherine Edwards, an infectious disease specialist and professor of pediatrics at the Vanderbilt University. That's the reality out there. We're trying to figure out how to use methods that have been the purview of bench scientists. The Dartmouth whooping cough story shows what can ensue. You cannot imagine, Dr. Talbot said. I had a feeling at the time that this gave us a shadow of a hint of what it might be like during a pandemic flu epidemic. Yet, epidemiologists say one of the most troubling aspects of the pseudo-epidemic is that all the decisions seemed so sensible at the time. Here we are a year later, locked down, and it seemed like good intention after good intention after bad decision after bad decision. Oh wait, sorry, that's 2007. Interesting, right? I think that it's very interesting that we knew the potential pitfalls of using this test. We knew it, and we did this anyway. We knew it in 2007. It was public. We knew it, and we could share that information. We knew it, and the public health people should have known it, right? And I think that it's interesting that nobody said anything about it, right? Nobody said a darn thing about it. Here's something else that we know, and I haven't been splitting the show up the last 2 days because I didn't think that there was anything really YouTube could be upset about that I was talking about, except yesterday I kind of waded into it a little bit. Today I'm going to be splitting the show. I've got some spicy memes to show you, etc., but not yet. We've got lots more YouTube show to go, but I wanted to let you know we're going to look at vax coercion in this part of the show because I think it's really important, and then we'll talk about vaccines in the redacted part later. Okay? All right, back to the show as usual. Another weird thing is they keep telling us that carbon taxes are going to help somehow with saving something or other, reducing CO2 or something like that. If not reducing CO2, then doing something meaningful with the tax money to... No, I think that they want to avoid... The whole goal is to avoid the catastrophic warming or something like that of... the amount of CO2 that's projected to go out, except that here from taxpayer.com, it says the provincial government is taking more than $1.9 billion in the BC budget, in the upcoming BC budget, in the BC carbon tax this year. Yet emissions in BC have gone up from 59.2 megatons in 2015 to 65.7 megatons in 2019, an increase of 11% in 4 years. Yeah. So, and I've said before that between 2008, when this came into effect, and 2019, I think when I did more deep dives on CO2 and carbon stuff, they didn't meaningfully reduce CO2. And we had benchmarks from other places that didn't have a carbon tax and that were able to either stay relatively stable with their CO2 use or actually reduce it. Ontario is a good example. I think that Ontario stayed relatively stable, but Ontario increased at a slower rate than BC, even with BC's carbon tax. Why? Money, taxes, money, right? And government subsidy, right? So right. You get more of what you incentivize. That's just how it works. Okay, here is question period. Evan Solomon and is interviewing Jagmeet Singh, and it says, on these two specific grounds we support it. They're talking about the constitutional amendment that Quebec wants to make, and they just support it. They're just like, oh yeah, it's fine, no problems, no problem at all. Here they go.
Todd, do you think Quebec has the unilateral right to change the constitution and say Quebec is a nation and that French is the only official language?
On these two specific grounds, we support it. It's pretty obvious that French is the language of Quebec, and Quebec is a nation. It's been something that's been supported in Parliament. Previous governments have declared Quebec a nation. So these are two important declarations that are not in any way controversial. It's both of them are founded. And in terms of language rights for minority language groups,
the controversial thing, though, that Mr. Jagmeet Singh is not talking about is the opening of the Constitution to declare Quebec a nation, right? The statements that he's talking about were made in the House of Commons, and people were saying that, yeah, like this is true, but they didn't want to amend the Constitution. They didn't want to open it up or make changes, etc. But apparently everybody's just fine with it in 2021. Everybody's no problems with it at all, right? Here's a CBC article that talks about the same thing. Conservative leader Aaron O'Toole told Montreal's La Presse newspaper that he believes Quebec is able to alter parts of the Constitution by itself. But earlier on Tuesday, Michelle Rempel-Gardner, an Alberta MP and the party's health critic, posted her own reaction, suggesting Trudeau was setting a dangerous precedent. So by the same token, Alberta should be able to unilaterally amend Section 36 of the Constitution Act, she wrote on Twitter, referring to a section of the Constitution that covers equalization payments. That's why it's a slippery slope. That's why it's controversial. That's why there's a problem, right? And the party leaders, both of them, should be aware of that. And it's interesting that they're not. Interesting that they don't care. Here is the education unions fighting with the premier, trying to keep schools closed. I've been talking about this for a while. Provided that the kids can get out and play with their friends and have regular play dates, and they should have regular play dates with friends. That's important for mental health, especially for kids. That's how they learn. That's how they grow. That's how they play. Get out to the park a couple of times a day, and they'll create their own peer group. Especially if you go at the same time, right? They'll do it themselves. They need it, right? I was talking about kids wrestling at the park the other day, and they're just playing, right? It's just kids figuring out how they fit. That's all. And until it's not, right? And that's why parents should be around and supervising and all that other stuff. But kids should be and need to figure their place out. But anyway, the EFTO or ETFO president, Harry Bischoff, I think I said that, OSSTF, president of OSSTF, excuse me, says, Premier Ford said today that education unions are seeking injunctions to keep schools from reopening. We had made no such threat and no legal action pending and have not heard from the government since the move to remote learning. And then Rizal Robin says, here's the lawsuit, actually. So that's interesting, right? That's interesting. So she says, here's OSSTF's motion for an injunction against York Region in April. Can you clarify your position? If York were to open schools now, would OSSTF continue to seek an injunction? So she's asking for clarification. Interesting question, right? No answer. And it's the 24th, and this was asked on the 21st. Interesting stuff, right? Interesting. Okay, police. Groups of police officers file constitutional challenge over Ontario pandemic rules. The claim seeks a number of declarations, including that lockdowns and stay-at-home orders are a form of martial law, which the province does not have jurisdiction over. So I think that it's interesting. I've been kind of hinting martial law, like saying outright, like it looks like our charter system is suspended, our basic rights are suspended, and it seems like our travel rights are suspended. This seems like, well, the definition of martial law is that it's military law with usual rules and laws suspended, right? So hold on, I'll get the exact definition to be clear. Here's the Google definition, so take it with a grain of salt, because Google, right? Martial law, military government involving the suspension of ordinary law. Okay, so I'm saying that ordinary law is our charter, and if the charter is suspended, then these things make a little bit more sense. Like this too. Here's a Hamilton officer, possibly Toronto officer, giving a ticket for shaking hands. Here's just a quick cut for that.
Okay. So that's strictly just for shaking hands with someone?
For shaking hands, not maintaining 2-meter physical.
Okay, so for the record, can I get your name and badge number?
Yeah. Wow. Right? So shaking hands with somebody is not maintaining physical distancing, and so that's a problem because, here's another violation of our charter rights. It says police ordered more than 100 drivers to turn around at road checks put in place in BC highways this weekend to prevent non-essential travel. 2 drivers were charged for allegedly failing to stop for police. So you could drive through, but you get a ticket. And so some people decided to drive through. But this is suspension of usual laws. Usually you would be able to drive where you want in Canada without police stopping you. Aren't there other things for police to be focusing on? How is stopping a family from moving from one place to another stopping the spread of the virus exactly? Could we be very clear about that, right? I'm not sure. Feds say there's no specific date planned for restarting travel in Canada. Federal Transportation Minister Omar Algara has revealed that there's no specific date set, right? And so it says the decision will depend on public health data and evidence. At this moment, I can't give you a specific date. We're going to have all these measures and all of these thresholds outlined in detail when we feel it's time to do so, he added. I wonder when the Canadian government would feel like it would be time to do so. Like, we've got a whole bunch of U.S. states opening up. We've got people who are pretty sick and tired of being locked down. We've got a high rate of injections for the shots, right? I think that, and they're increasing the rate of injections because of vaccine campaigns and pop-up campaigns. So they're getting all sorts of compliance there. What could possibly be the excuse to not have a plan in place for reopening travel, right? To not think 3 or 4 months down the road, right? Or even weeks down the road. Like, people should be getting prepared for this, should they not? They should have a date. They should have plans. They should be able to make plans. No? Very interesting position, right? All right, getting into healthcare. Doctors in Manitoba call on province to develop and implement triage protocols amid ICU strain. So the triage protocols are the ability to withhold healthcare because the ICU is so overwhelmed. Previously, we would not be allowed to do this, but because it's COVID emergency, these experts are demanding this. Garbage. Absolute garbage. Here is doctors are being censored, says Patrick Phillips. This is Kate did a video, and it's very worthwhile, very well done. I thought I had the video link. I thought it was right in here. Twitter's being crazy. I had the video link. It was in one of the... Hold on. If I had just read the tweet, it was there all along. Here's the video link, right? It's a 9-minute video talking about how doctors are being censored, and it compares... it's a very powerful video. Kate did a great job. It compares their oath, the oath they take, etc. And Patrick Phillips says, watch now, doctors are being censored. CPSO and CPS BC are threatening doctors in Ontario and BC with investigation and discipline if they can contradict public health orders, even if those orders are harming their patients. Yeah, it's a wild video, and you should check it out. It's the Dr. PMD link if you're interested. And here's a second Dr. PMD. It says, this is why it's essential that nurses be allowed to speak freely. Silencing of nurses and physicians by the College of Nurses and CPSO is a major risk to public safety in Ontario. And Gretchen says, my unit has been seeing 2 or 3 admits a week with post-Pfizer or Moderna myocarditis in young patients, younger than 45, with those 30 and up critical. Cardiologists and hospitals who round are freaked out, as are the nurses. Hospital symptom system is now capturing data on anyone coming in post-vaccination. At least somebody's capturing the data. That's good. Here is Jason Kenny says the people that are getting ill and hospitalized now are overall younger and without compromising health conditions because we took steps to protect vulnerable Albertans first. The strategy has worked. Now we just need to get everyone else vaccinated. And he says 40% of those admitted to hospital since February 1st were under the age of 50. I would like to see the raw data on that because I'm skeptical about the numbers and stats that politicians typically use. There should be some rule that says if you cite a stat like that, you should have it sourced. You should have it sourced from they should have to use specific data sets that the public can then look at pretty easily or something to that effect. Maybe they already do. Maybe my wish list is just I should be more informed. Okay. This is a little bit spicy, this video, but I think that this is important to show on YouTube. There's a whole bunch of places that are getting rid of their vaccine passport. And this guy says that the whole point of all of this is the vaccine passport. And he's talking about the UK government. I don't know what's true, but I think that people talking about this kind of stuff bear listening to and thinking about, because it will have massive implications if we go this route, if we go the route of a vaccine passport. Now, the good news is it looks like Israel had gotten rid of the green pass. Denmark said no to vaccine passports. So it looks like there's a possible turning of the groupthink on this, but I don't know. I don't know what's going to happen. But anyway, listen to this. Here we go.
Going to happen to our world, to the fabric of our society. I'm worried about the future of my children. Listen to what happened yesterday. You probably missed this because it was while we were on conference. China is petitioning the World Health Organization to appoint it to run a global immune passport program. Now, if that doesn't scare the living daylights out of you, I do not know what will. This kind of centralization, this kind of control, social credit systems, that's dystopia for you. We need to push back against this stuff because it's coming. It's coming. The UK government has been denying that they were planning to implement social credit, vaccine passports, this kind of thing, at the same time that they've been commissioning tenders. Yeah? They're lying to the public about this. And you know, when it went up to vote, the second vote on this bill that outlaws dissent in the UK, outlaws dissent. Not a single member of the Conservative Party voted against it. This stuff is disturbing. And so that's my motivation, mine.
Yeah. I mean, he laughs. He's like, this stuff is disturbing because not that you can't engage with it seriously, but it is so past what people were expecting to have to deal with. This is we're replaying history. It is wild what's happening. And it's not just one country that we're replaying history in. It's worldwide. Look at this. Here's global news. A majority of Canadians are in favor of using COVID-19 vaccine passports in order to travel, attend university, or go to a concert, Ipsos poll shows. 814 likes. I don't know how many of those are purchased because click farms exist. And then it goes through a bunch of different stats talking about how acceptable vaccine passports are and making the case for vaccine passports. And then it finishes with a poll. A recent Ipsos poll found that a majority of Canadians were in favor of using COVID-19 vaccine passports in order to travel, go to a concert, or attend university classes. Would you support the implementation of vaccine passports? 64% said no, of 11,000 votes. Twitter's not real life, but it can be a bellwether. That's interesting. That the poll that Ipsos found came to a conclusion that a large majority of Canadians support a vaccine passport. But when tested on Twitter, that hypothesis is blown out of the water. But the news is the paper of record, and not necessarily global, but a consortium of different newspapers saying the same thing says, well, yeah, this is what was happening in Canada. These Ipsos guys, they did the poll, right? So it's interesting. It's manufactured consent. That's what that is. And we need to be paying attention to it. Here's Denmark. Denmark says Dr. Cor Gill says Denmark joined Israel and previous dozens of jurisdictions in the U.S. and globally in ending lockdown restrictions and banning vaccine passports. It's time to end your tyrannical and catastrophic policies causing horrific harms now. She's talking to Justin Trudeau and Patty Haydu. And here is the UK. This is Australia. Talking about how I'm not going to play this, but talking about how vaccine passports were to distract from a horrifically bad vaccine rollout. And not that I think that that's accurate, but maybe if they're backing off on it, okay, I'll play a little bit of this, but if they're backing off on it, then maybe there's a reason for that, right? So hold on, I'll just back this up a little bit.
Incentive to get people vaccinated. What do you make of the idea?
Look, I think the idea has only been rolled out because in some sense it's a distraction from the failure to roll out the vaccine. If we'd properly rolled out the vaccine, there would be no need, certainly at a national level, to have any sort of vaccine passport. This is just, in some sense, a distraction away from that, the fact that things have gone terribly wrong in that space.
So, look.
So it's not just Canada that has had a terribly bad vaccine rollout. It's other places in the world. Other places in the world are discussing the same terrible policies that Canada is discussing. Is this coincidence? Is this incompetence? Is this a plan, a coordinated plan? Right? And it's not like people haven't pointed directly to written down plans that say this is what's going to happen using a disease of some kind. So who knows? I don't know. I certainly don't know, right? But I've seen those plans floating around the internet. Sure have. Israel to lift almost all pandemic restrictions on June 1st, including the Green Pass. Right? This also includes the Green Pass vaccination certificates. So very interesting. Some people were saying, yeah, because they got everybody vaccinated through the coercive tactics, so they didn't need the vaccine pass anymore. Evidence is damning, says Alexander McCarn. Texas opened up, fewer vaccinated than the UK. No masks, no vaccine passports, and cases continue to decline. No lockdown will ever engage. No lockdowner will engage with this data. Because it shows that all of this stuff is not really necessary, right? Here is, this happened in Saskatchewan, telling kids they can see their friends if they get vaccinated. So this is a picture of something that was sent home from school. I want to get the vaccine. This is like a question answer letter. I want to get the vaccine so I can do more things with my friends, but my parents are against it. Can I still get it? If you're 13 or older, yes, you can. In Saskatchewan, we have something called mature minor consent. That means if you're at least 13, and as long as you understand any risks, as noted in your information packet, you do not need a parent's permission to receive the vaccine. Mature minor consent applies to any vaccine in Saskatchewan, not just COVID-19 vaccines. You will need to think hard about your decision and talk it over with your parents. If you're 12, you will require a parent's permission to receive the vaccine. Is that coercive to you? I don't know. It seems like crossing a line. How about this one? Vaccine Hunters Canada. Get your Pfizer shot. Right, there's a shot there. And free ice cream. Right? This is the shot and the soft ice cream emojis used side by side by Vaccine Hunters Canada. Today starting at 10 a.m. Nathan Phillips Square. 12 plus from all M codes. Right? Health card not required. Don't you need a health card to see your doctor? How's this health card not required thing? Bring proof of address. First dose only. First dose only. That's interesting, isn't it? This is, I'll leave the YouTube show here, And this is Nathan Phillips Square. There is a direct call out of anti-vax protesters, and she like preps people who might be coming down and says, don't worry, we don't worry about that. It's fine, just come on down. They apparently had 2,000 doses and administered 2,500 last night at this one, according to a tweet I read this morning. Anyway, here's the video. Hold on, I'll make it bigger. Here it is.
We've got a live DJ, free ice cream in a line about 100 people deep here at Nathan Phillips Square. The city is holding a vaccination pop-up, and of course today, all across Ontario, kids 12 plus are now eligible to book a vaccine. So I am seeing a...
Kids 12 plus, come on down! Listen, I think that it's funny that a child is not allowed to be explained the risk of smoking. Listen, kid, you might become addicted to this. And it might kill you. And this cigarette, it's really bad for you. Yep. Pass them over there, Pops. Sell me those cigarettes, right? Can't do that if you're 12. But you can be given this this product, right? Wow. Wild. Carry on.
A lot of teens. I mean, when you've got free ice cream waiting for you, it is certainly an incentive. Now, you may hear a little bit of chanting in the background. We've had about 24 anti-vaxxer protesters turn up. They're shouting things like, shame on you, parents, to those waiting in line with their kids. But I can tell you no one here seems fazed by that. There are 2,000 shots available.
Listen, if you hear chanting, don't worry. This is what they're saying. They're saying, shame on you, parents. Shame on you. That's what they're saying. I'm honestly shocked that this is news. This is the news that they're pushing out. Come on down, teens. Come on down, 12-year-olds. We can get this vaccine to you. Come on, kids. I'm shocked. I'm shocked. And I can't believe that there are people who are just totally fine with this. There are people who are just fine with this.
And the city says they'll run this clinic until doses run out.
Big smile. Doses run out, right? News finish. I think that it is interesting to see the ease at which people will promote something that is right-think. I think it's interesting to watch what is rolling out and the compliance of people. It's like watching the mask compliance. I was shocked. I'm still shocked at seeing people outside with masks on. They haven't mandated it. People are doing it just by themselves. They're just making it part of the culture. And is this part of the culture war? Probably, yeah. Probably. Okay, to check out the rest of the show, and there's some spicy memes. I think they're spicy anyway. So too spicy for YouTube. To check them out, check out the Redacted Show. If not, that's okay. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Check out SpeakingMoistly.co, and have a wonderful, wonderful day.